We're the size of 5 pentagons. You would need another 5 pentagons of space to be able to safely accommodate all of the students in Fairfax County Public Schools.
They're a wealthy district, but even with money, it's just not feasible. So what is your recommendation given that reality?
My recommendation is he take up the offer to meet with my team and some of the folks from the CDC and the task force to talk about ways that they can look at this freshly.
We're going to obviously do our very best in our community, considering where the health data currently is. A positivity rate of 29.1%. A month ago, it was at 6%. Our start of the school year is 6 weeks from now. But we need the community's collaboration. We need the science to drive the practice rather than politics influencing what is legitimately a community concern.
Oh, this is appalling. The president and his administration are messing with the health of our children.
But you are arguing over and over that they should handle this on a local level. But at the same time, as the Secretary of Education, you are trying to push them to do a one-size-fits-all approach, which is go back and reopen schools. You can't have it both ways.
I am urging all schools to be to open and to be providing their students a full-time education. We all acknowledge that that could and may well look different in a certain area that has a flare-up of the virus.
Everyone wants to see kids back in school in the fall. The big question out there right now is how to do it safely. President Trump said this week that he thinks the CDC guidelines are too tough and too expensive. Do you share that concern?
I think the CDC guidelines are really right on target.
If there are CDC guidelines, they should be requirements.
Is it time for a national mandate?
You know, I'm not the person who can say who can nationally mandate things, but let me tell you, it is really essential to wear a mask in public. To the data we have right now, there's no downside to wearing a mask. And for this to work, we have to have like 90% of people wearing a mask in public in the hotspot areas. If we don't have that, we will not get control of the virus.
Are there some ideas that you can't propose because the president will never accept them?
I want to just put this to rest. There is complete, open, honest discussion within the task force. Nobody feels like anything is held back. We all take this as a serious crisis. It's got to be science driving the policy, and that's the way it is.
I want to show a graph from the New York Times showing the astronomical increase in cases in places like Florida, South Carolina, Arizona, Texas, and Georgia since they reopened. But is it time to consider more stringent lockdowns in those states?
What we model are the most important interactions are closing bars. Limiting the capacity of restaurants is an important thing. These are two measures that really do need to be done. We had no data to suggest that this would go away, and we know 90% of our population is still at risk for the coronavirus. I do think in the fall we're going to need tens of millions of more tests per month, and we are planning for that because we'll have a lot of respiratory viruses like flu circulating. Very critical that people get their flu vaccines. You'll see a lot of actions in the next couple of weeks of getting point-of-care testing into the nursing homes at risk that will decrease the burden on the commercial labs, but also give people turnaround times of 15 minutes so we can control that. So it is all hands on deck. It's been all hands on deck since middle of March. Unfortunately, it's still all hands on deck during the summer, but we are preparing for the fall.